Thanks for coming to the interview.
Thank you so much for having me.
I'm Felicia Austin. I'm the Human Resources Director for Restorative Care.
Yes, ma'am.
And we are looking for CNAs that have recently graduated and passed their state tests. So I just have a couple of questions that I'm going to ask you. Take your time,
Okay.
answer, and if we need to come back to a question, just let me know.
Yes, is it okay if I take notes?
Yes. Tell me about your experience as a CNA.
Well, I'm recently certified, so I received my certification this month. I don't have any job experience, but what I do have is I've worked in childcare. I've also worked as a babysitter, and I just have a passion for helping people. And so that's why I actually went to CNA school, and I wanted to go ahead and pursue my CNA certification and hopefully in the future become a nurse. So I don't have any patient care experience, but I am willing to learn if you're willing to give me an opportunity.
Have you taken care of any family members?
I have. I've helped to take care of my grandmother, and then my mom, she's also a CNA. So some of the, terminology when I was studying for my test, it was so cool because she also was able to help me. So we do have caregivers in our family.
Okay, that's great. How do you handle difficult or agitated patients if you were to have one?
Well, with the kids, going back to my job experience, sometimes the kids would throw temper tantrums, and first thing I would do is breathe, make sure I remain calm, and then I would try to figure out the reason why they were being agitated or acting out. And if I could figure out that reason and console them, then usually they would calm down. And of course, if it was just one of those temper tantrums that I couldn't get them out of, I could always call their mom. And I'm assuming that at your facility, if there's something I can't handle, I would be able to call the nurse or someone else to assist me.
Yes, that we do have our staff on hand, especially with new hires. So you will have a mentor and you will be able to shadow
Wonderful.
for a couple of weeks. With the pandemic, so we do have elderly patients and we do have family members that come in and out. So how would you handle and what infection control measures would you follow?
Well, our teacher was huge on hand washing, and sanitization, and making sure that our uniforms, don't touch the bedding or the linen. So those are some of the things. And of course, gloving when appropriate. And if someone has a respiratory infection, then we'd be masking or, maybe a full face shield. I've not had too much experience with wearing a gown, but I assume that would be part of the criteria also if somebody has COVID.
Okay, good answer. I appreciate that explanation. We're very busy here at Restorative. We're very busy as well as being a residential. We're also, we do rehabilitative services. So sometimes it's really busy. How would you prioritize your tasks during a busy shift, which is mostly our morning shifts?
Mm-hmm.
How would you prioritize?
Well, with me being so new, definitely hopefully learning the ropes from a nurse or a senior caregiver. I would assume that finding out what's on the patient's schedule for the day or the resident's schedule for the day and trying to go about it that way, or asking the nurse what's the priority. And initially that's what I would do, and hopefully with experience I'll be able to figure it out myself so I wouldn't have to ask the nurse so many questions about which patient to see first.
Yes, it's very good to use your resources, and like I said, you will have a mentor and you will shadow, so make use of that. Okay. Can you describe your approach to assisting with daily living activities?
Yes, ma'am. So, of course, including the resident, I don't want to make decisions for them. I want them to be as independent as possible. So I want to ask them, instead of just picking out a sweater or something to dress them in, ask them to actually participate in their care to see how much they can help. So with things like allow them some independence, or as much independence as they can safely. And then what they can't do safely, then of course I would assist them with. And obviously with transfers or something of that nature, making sure they have their shoes on or non-skidded socks before we get them up and move them about.
Okay, great. So as I said before, sometimes we're dealing with the elderly. They can be difficult. And sometimes you may get one that refuses care. So how do you handle a situation where a patient refuses, I don't want to bath today, or I don't want to take my meds today?
Try to find out their why. Try to build a rapport with them. You know, of course, we still have a professional relationship, but try to actually be their friend. Because if I can understand their why, maybe they don't want to eat or take a bath right now because their favorite TV show's on. So I do believe in being flexible. Flexibility matters. I like flexibility, and I'm sure the residents would also like it.
Yes. We deal with a lot of medical information here at Restorative, and we deal with a lot of, as I said, rehabilitative. Some of our patients are well known, you know, for rehabilitation. So confidence is very important to us. What do you know about patient confidentiality?
Patient confidentiality. Well, of course, HIPAA. You don't want to share information about a patient with somebody who is not, you know, on the primary care team. So keeping their information confidential, not discussing it in the lobby, in the hallway, etc. Pretty much only sharing it with the nurse or, you know, part of the team, and maybe the CNA who will be relieving me. Outside of that, if a family member or something comes and asks questions, and unfortunately with me just being a CNA, I can always refer them to the nurse, and the nurse can answer those hard questions.
Again, use your resources. And speaking of team, describe a time when you had to work as part of a healthcare team or a team that made decisions for others.
Okay, a team that makes decisions for others. Where during the summers I work as a mentor, and as far as a mentoring team, we will actually go out to different camps and we will work with the youth. And you know, just actually being there, actually delegating tasks, because you don't think about how much we have to do in order to keep those kids safe. But you know, at the swimming pool, who's going to be where, who's actually going to, you know, who's the best swimmer if there is an emergency. Of course, we all had to learn CPR. So those, I don't have experience in the healthcare field per se, but the experience I do have with delegation and just following through, and if I'm not able to perform a task, making sure that someone else is aware of it so they can assist me. I just want to make sure that I answer that question.
Yes, and thank you for giving a very good example as well.
Thank you.
So again, patient care is our primary.
Okay.
And we do have some patients that they may have Alzheimer's, they may be on early stages of dementia, and they may become a little agitated or anxious. And we do have family members that are upset or anxious about something. So how would you handle a situation where the patient is anxious and the family member is anxious?
Again, trying to figure out the cause. For me, I get anxious if I'm in an unfamiliar environment, or if I'm asking someone a question, they're not giving me the answer. And so with my grandmother, when she got older, it wasn't diagnosed Alzheimer's, but she had some forgetfulness, and she was a little bit more difficult to deal with. And just being calm and reassuring, eventually things will get better. And when I couldn't calm her, I would contact my mom, who's a CNA, and she would give me some information on, you know, what I could do to help calm her down until she was there to take over.
It sounds like you're very compassionate about understanding people. That is a good quality to have.
I try.
So you mentioned transfers earlier. Can you walk me through how you would ensure patient safety or mobility assistance?
Yes. Well, first I want to actually look at the orders to make sure they have an order to get out of bed or to transfer. So actually knowing what the doctor has prescribed for this patient's activity is really important. And then, you know, speaking with the nurse or the nursing team or whoever is relieving me or I'm relieving would be important, because if they have a technique or if they use a piece of equipment, I want to make sure that equipment is nearby or in the room in case we do have to transfer the patient. Safety, keeping, if the facility has rails, because not all facilities have rails, if the beds have rails, you know, allowing the resident to use the rails to help get up, get them to the side of the bed, allowing them time to just sit there and, for a moment or so,
gather their thoughts,
thoughts so they don't stand up too fast and their blood pressure drops, and, making sure the feet are on the floor, etc. And if I have, any concerns with the patient, let's say a patient who previously could get up and transfer and walk, if on this day they're weaker, that's not going to be somebody I would attempt to transfer by myself. I would ask for help because patient safety is always my priority.
Thank you so much. Again, some of our patients are bedridden, and they don't get up as often as they would like. So what steps do you take to prevent pressure ulcers in bedridden patients?
Fortunately, we had a really good teacher. So between repositioning every 2 hours or more often as needed, and then offloading the heels, asking the patient where they hurt, because pain could be a sign of a pressure sore. Some people say redness, but pain could actually be present. Making sure they eat enough protein. So if somebody's not eating or if they're not drinking, that's also going to cause issues with their skin and their musculature, which will make them more likely to have a pressure sore. And I have to make sure that they go to the restroom more frequently because we don't want their skin wet. And do you allow diapers or incontinent briefs here at your facility?
Because we deal with a lot of patients, again, that are either elderly or in the rehabilitation, we do have those supplies for them, but we do encourage our patients to try to get up and walk around because that's part of their recovery, those that can.
So if somebody has, if their diaper is wet, making sure that I change them quickly.
Yes. Okay, can you explain the importance of documenting the care that you're going to be giving, that you may be giving to the resident?
Yes, well, number one, it informs the team of what care has been provided, and then number two, it's just, it protects myself, it protects the nurse, it protects the facility, because it's going to actually show that, this care was rendered, what time it was rendered, who it was rendered by. And so if you're talking about turning somebody every 2 hours, if I'm not documenting that, and the patient actually does develop a pressure sore, someone can say that I was the person who caused that injury. And so I would never want that to happen. So I've been taught to document.
Oh, very, very good. Things change, practices change, protocols change. How are you planning to stay updated on the latest CNA practices and protocols?
Well, I love computers, so as I was walking down the halls, I saw that you all had a lot of computers. So I'm hoping that you all do offer, some type of in-services or extra continuing education. I love learning, so if you all are offering the classes, then of course I would love to take them, here. But if not, I can always seek outside resources to take classes to continue my education.
That's good. That continue your education is a sign that you want to progress. And I did hear you mention that your goal is to become a nurse.
Yes.
So the additional training will come in handy for you. What would you do if you suspected a fellow staff member was neglecting their duties?
I'm telling. The patients are my priority, and I would hope that would never happen, but we're mandatory reporters, so if I don't tell that a resident is being, that I suspect abuse or neglect, well, I'm part of the problem, and I don't want to be part of the problem. So I definitely report it to a higher up.
Thank you. Patient care, again, is our priority. So, we talked about ulcers earlier. How do you handle a situation where a patient is in severe pain?
Severe pain, I've not had that yet, but my little brother, he broke his ankle, and so when he was in severe pain, of course, he'd been taken to the doctor, was released. So if the patient hasn't been seen by a physician or a nurse, I'm going to notify the nurse so that the patient can be seen. If it's, especially if it's something new that had not been reported before. But as far as the CNA, I would elevate if necessary, reposition the resident, definitely notify the nurse. And before I do any activities such as range of motion, just check with the nurse first, because if there is some pain pills or something that she could give the patient, maybe the patient's in pain because they've not had pills all day, because they haven't requested them. So I just want to make sure that I notify my supervisor, my nurse.
Okay. I do recall you saying that your grandmother may have had early stages of dementia.
Yes.
Can you describe your experience in dealing with her?
Yes. When I was there during the day, she was okay. It was more towards the evening hours when she would start not knowing which grandchild I was, calling me someone else's name. So a lot of reminders, not to upset her though, because sometimes if I was just really, hey grandma, my name is not, she'd become upset.
So, right, that does cause it, them to be more agitated. So sometimes you just have to go with it, right?
Yeah, after I tried to reorient her and it didn't work, it's whatever grandchild she wanted me to be that day.
Exactly.
But her doctor was aware, and she didn't do any wandering or anything because we actually had alarms, the doors were locked. So just keeping her safe within the home, and someone was always there with her.
Okay. We try to be very compassionate and caring. But sometimes, working with people who are not at their best can be very demanding. So how do you maintain your compassion and caring in an environment where people are constantly asking something of you?
I'm just going to say that on my days off, I'm going to enjoy them thoroughly.
Good answer. I do as well.
Because especially when you want to be a nurse, and I know that this is just a challenging field and that some days are going to be better than others. So try to be understanding, work your days you're supposed to work, and on your days off. I love walking the river. I love waterfront areas. So just making sure I really utilize nature as a healing source for me.
Oh, okay. I'm interested in knowing if you can tell me an example of a challenge you had in pursuing your CNA certification.
Yes, finances. So, not having the finances or the resources. So actually sacrificing, continuing to work at the camp during the summers, earning enough money so that I can actually pay for my CNA examination. Then the challenge of actually having enough faith in myself to complete the course, to take the test, having all the anxiety related to taking the test and passing the test. And now it's like every time you complete one obstacle, here comes another. And so now I'm here with my first interview. So I'm not sure when the obstacles end, but yes. I do foresee a walk along the riverfront.
Yes, you have to be determined and resilient. And a lot of people, they go through the process, and then when it comes to, something like the interview or starting on the first day, they kind of back up a little bit. So I commend you for, continuing on.
I want to thank you for interviewing a new CNA, because everyone was like, hey, you're new, no one will hire you. And I'm like, well, I'm going to try anyway.
Well, at Restorative, we, understand that one of the challenges for CNAs is getting their foot in the door and working in a health environment, a healthcare environment. So we are very open to having new CNAs because, ultimately we want everyone to have the best care. And we believe that we are a very good facility and that our mentors do exactly what, they need to do for people that are CNAs to want to go ahead and pursue nursing.
Wonderful.
So what do you do to ensure a clean and organized work environment?
So, picking up behind myself, with the kids, picking up behind others, with grandma, just making sure there was nothing on the floor that could be a fall hazard for her. With the kids, making sure there's nothing on the floor that could be a choking hazard. So it's always like, looking around, making sure that everything and everyone around me is safe. And would you repeat that question one more time for me?
So we have to maintain a clean work environment here, not just for the patients, but for the staff as well.
Okay.
And for example, we had a nurse that loved coffee, and you do the gentle reminders, but then coffee spilled on her computer, and that was just a reminder to everyone else. clean, organized, safe,
Not
working.
having coffee and food. That's why you have those signs. that
Yes,
say no,
that's why we have those
no
signs.
food at the nurse's station. Now I
Yes,
understand.
this is why. Yes.
All right,
And
so,
we don't want to have mustard in our files as well. We've had that happen too.
I can imagine. So definitely keeping work areas clear, food or things that could spill, and then if the trash is overfilled, just go ahead and take care of that. It's everybody's duty, not just housekeeping, to keep the facility clean.
Exactly. So at Restorative, we do offer end of life care. And it is, a very difficult wing. And sometimes as a CNA, you may be called on to, assist in that. So how do you handle end-of-life care and support for not only the patient, but their families as well?
Unfortunately, but fortunately, with my grandmother, I was there for that process. And so holding her hand and actually learning from the nurses who were there, who was telling us about the end of life process. So I think the company was hospice.
Mm-hmm.
So the hospice nurse came in, and so, teaching us about, the pain medications, what they were going to do, and how we would know when grandma was worsening. And so she was really supportive. So everything I know about hospice, I know it from firsthand experience. And it was sad because it was my grandmother, but it wasn't the worst experience because we were right there and she wasn't in the hospital, and we did everything at the house. And so she was able to live the end of her life in peace around people who loved her. And so, yes, hospice is, or in the life wing, I'm sure it is a hard place to work, but if you're around loving caregivers, I think that it would be manageable.
Okay, so we have talked about, qualifications, duties. Now I want to talk about units.
Okay.
So tell me something about yourself.
I love outdoors. I'm a native of Jacksonville, and I'm just looking forward to, seeing what part, because everyone says there's so much you can do with a CNA or a nursing license. So I want to, just learn as much as I can so I can make the best decisions about my career in the future.
Okay. What made you want the CNA position at Restorative?
The hours, because it was rare that you can find like 8-hour shifts. So when I saw it was an 8-hour shift, and then you all put on there that it was a new facility, which it is, so it's updated, and everyone seems really nice. So the time that I've been here, everybody's been speaking, so it's a really warm environment. I would not have known that without the interview, of course, but now that I'm here, it's just reconfirmed, that I think this is where I want to start my CNA career.
Okay. Yes, we are very family oriented. When I give you the tour, you will see that we actually have a staff family room, so that when how people come and pick you up and they wait in the car. So we have a family room for, spouses and children to wait. They have 30 minutes to
That's
come in
wonderful.
earlier. So, because it's Florida, it's hot, it rains. So we have a room for our staff family to come in and wait for about 30 minutes
That's
before
really
their family member gets off the shift. So how do you handle challenges in your personal life?
Breathe. Think twice. Speak once.
It sounds like my grandmother.
Like I really want to think about what I say before I say it. And understand. I give myself grace to be human. I give myself grace to make mistakes. I don't think that I would intentionally hurt anybody. But if I do make a mistake, I own up to it and I apologize.
Okay. Which is good because, as you say, we're all human and no one's perfect. So, you are a new CNA, but it seems like you have a lot of life experience. What are some of the skills that you think you can bring to the team?
Okay, so my patience, my compassion, the fact that I'm semi-okay with end of life care, or dealing with somebody who has dementia, dealing with hyper people, because I also dealt with the kids also. So I think that I'm well-rounded. I may not have, the most bedside experience, but I'm a fast learner, and I think that's a benefit to a team because no one wants to continually keep reteaching something to someone. So I think if I see it, you let me put my hands on it, I understand it, and I'd be able to actually perform that task.
Okay, you have done really well. I just have one final question. Well,
Yes,
maybe
ma'am.
two. How do you prioritize or how would you manage if you had to be called in unexpectedly because we're short-staffed?
And unexpectedly, because of the work-life balance, I'm not sure how if my family would be able to assist. But, I also have, my family that I have to tend to also. So if it's something that I can help with because I have, child care or whatever in place, then, I'd be happy to assist. But that'll be a little bit more challenging because of my family dynamics.
Okay, we try to give at least a shift notice
Okay.
if we can, because again, we as staff members and directors are very family oriented as well. So, sometimes people do have to come in. We usually do the schedule so that we're covered, but again, we're all human. Things happen. Eunice, I want to thank you so much for coming in. I really appreciate the honest and transparent answers that you gave. It seems to me that you will be a very, very good person for our team. I will be speaking with the other directors as well as the shift nurses, but I want to say thank you again, and I really appreciate your answers. They were very insightful and very detailed.
Thank you for being so patient. So if I am chosen or selected, what's the process from here?
The process is that, again, I'm the Human Resources Director. This is your first interview. You will have another interview with one of the lead nurses in whatever wing we select you for. You'll have a day with that. We do have, again, like I said, a mentoring and shadowing process that is about 2 weeks that you will pretty much just observe for 2 weeks, and then we will slowly integrate you into whatever team that we think you would fit in. We do have vacations, we have sick leave. Again, we have our family room for our staff. I know that we have 2 staff members who kids get out of school a little earlier than they get off from work. Those kids they come every day. So we again try to work around your schedule, and as always, if there's anything that you have a question with, I'm sure you can find someone to answer for you.
And my mom told me to ask you this question. I hate to ask you this, but how many residents or patients do we per CNA on average?
We have 4 wings, and we have about 20 patients per wing. The way that we're set up, we want patients to feel like they're at home. So most of our wings, we have 2 that just have one. They're like 1-bedroom suites, and then we have another wing where it may be only 2 people in the room. That's our max. And then of course we have the rehabilitation wing where people just come in and out. They may be here for a week, a day, a month. So that is where a lot of our rotation is, in the rehabilitation wing.
Right. And so just based on what wing you're working, that's
Right,
how you determine how
that's
many
how-
residents you have?
Right, yes. You will get a residential list, and that list is very detailed. It tells you, when the patient arrived, what they're here for, what care that and you would look at it every day. Every morning, or whatever your shift is, you come in, you're going to review the patient list, and we're color coded, so you would know what rooms you are assigned to.
Yeah, this is a big facility.
It is. It's color coded. So if you're on the blue team, when you get your schedule, it has all the residents. You'll see everything for the blue team for that day.
Okay. So again, I appreciate you. So thank you so much for interviewing me.
Thank you. Do you have any other questions?
No, ma'am. Just ready for the tour.
Okay. Thank you so much, and we'll get started on the tour in just a few minutes.
Yes, ma'am.